We'll grab our lightest loop band, setting it to the side, and we'll grab our anti-burst ball to place under our pelvis to elevate our hips up. Take your pointer fingers to the bony protrusions of your hips and guide them down for some lumbar extension. With one hand, take one shin in towards your chest and extend the other leg out long. You'll want one hand on the ground for stability. The goal here is just to release the hip flexors before we work them strength-wise. They're not a posturally tight muscle, but due to how we sit, frequently they do get tight. Breathe here, squeezing the front of the extended leg's thigh. One more inhale and exhale, and then I'd like you to switch sides. Setting up, making sure you have pelvic stability as you extend that leg out long. You can point the toes, reaching through the foot as well. Make sure the foot is on the ground. It's not lifted in the air, because that'll make it a strength exercise. This is all about releasing your hip flexors. So breathe in through the nose, pull the abs in, squeeze the front of the extended leg's thigh, lengthen that leg away from you. The heel should have contact with the floor. So should one of your arms, so that you're not wobbling back and forth. One more breath here. And after that breath, place both feet on the ground. Lift the hips up into the air, pressing through the bones of your big toes, squeezing the abdominal wall, reaching the tailbone towards the toes. Slide that ball out and lower your back from the upper back, mid back to tailbone, back to the floor. Come up to sit. Grab your lightest loop band and place it around the arches of the feet. Lie back down on your back. Elevate the pelvis again by placing the anti-burst ball under your sacrum. Find that lumbar extension. Guide the bony protrusions of your hips down, creating extension. And then anchor your arms at your side, pressing them heavy into the floor. Let's lift your non-dominant leg up first. Dorsiflexing the foot, and we lower on our inhale, lift up on your exhale. 2, 3. Inhale, lower. 2, 3. Press through the bone of the big toe of your supporting foot. Reach the tailbone towards the bottom of your mat, towards your toes. Keep the lumbar extension, keep the sternum reaching towards the back ribs, the shoulders down the back of the neck long. Focusing on a nice dorsiflexed foot, keeping the knee tracking right over the hip, not in front, creating a right angle. The shin, once the leg is up, should be parallel to the floor. Give me 2 more. Lifting on a 3 count, exhaling, bracing the abs to lift, inhaling to lower, bracing the abs to lift, and inhaling to lower. Setting up on your dominant leg side, dorsiflexing the foot, and beginning when you're ready. Make sure the foot that's staying down the bone of the big toe is heavy, as if you have a quarter under it and you're trying to squash the quarter with the bone of your big toe. It's going to be really important that you remember this image and that you use this when we come to standing for lunges and squats. This will help your knee track better and help you not supinate as much. So I know you're breathing, using the breath to support the movement. The exhale on the effort as we lift the leg up. Inhaling to lower, tailbone reaching away from you, sternum reaching in towards the back body. One more here. Lifting on our exhale, lowering on our inhale. And you can kick that band away, lift the pelvis up, take the ball out from underneath, and peel the vertebra back to the floor, imprinting it into the floor, guiding the tailbone away, walking the feet in towards the buttocks, and placing the ball between the inner thighs. Hands down by your side, imprinting your arm extensors, the back of the arms, triceps, wrist, hands. Exhale, reaching the tailbone away from you to lift the pelvis into the air, squeezing in on the ball. Hold it here. Inhale 1, breathe. Exhale 1. Peeling down upper back, mid back to tailbone, pausing at the bottom to inhale. Brace the abs. And exhale, pick the pelvis up, pressing heavy into the bones of the big toes. Hold it at the top. Inhale 1, breathe. Exhale 1. And peeling down, sternum reaching towards the spine slowly. Articulating that spine. Tailbone is last. Inhale, prepare. Exhale, brace the abs. Lift the pelvis into the air. Press heavy into the bones of the big toes. Hold it here. Inhale 1, breathe. Exhale 1. Peeling down, sternum reaching towards the spine, vertebra by vertebra. Next time you come up, I'd like you to stay up, heavy the bone of your right toe, and extend your left shin. Hold it here. Inhale 1, breathe. Exhale 1. And inhale, lower that left shin down, switching sides. Heavying the bone of the left big toe, extending your right shin. Holding. Inhale 1, breathe. Exhale 1. And inhale to lower that shin. Continue alternating. We call this marching. Pelvis should be staying at the same height. You should be moving on your exhale to lift that leg up, pausing for a full inhale and a full exhale, and lowering on your next inhale. Keep those hips high. Tailbone reaching away from you down towards the bottom of the mat, sternum puddling in, collarbone wide, shoulders down the back. And finish your last one and articulate the spine as you melt down, vertebra by vertebra, bringing your tailbone to the floor. We'll grab our foam roller and we'll place our feet on it with the ball still between the knees, making sure the roller isn't too far away from the buttocks. Try to get it as close as you can without aggravating the knees. Then you'll wrap your feet around the roller like a bird does around a limb of a tree. I want you to really press into the bones of your big toes, even though the roller is around the arch of the foot. Hands are heavy at your side, and we're going to just lift the pelvis up, squeezing it on the ball as we brace the abs. And then we'll articulate the spine as we lower back down to the floor. Brace the abs and lift the pelvis up. Hold it up. Inhale 1, breathe. Exhale 1. Inhale. And brace the abs, peeling down upper back, mid back to tailbone. Continuing. The goal here, continue as I'm speaking, is to brace your abs and not have the roller moving forward or back. It's to stabilize the roller using your abs, using your glutes, using your feet. So feel the bones of your big toes as you wrap your feet like a bird around a tree limb. Really brace that roller, trying to stabilize it. On your next lift up, I want you to stay up, and we're going to try our marching here. If the marching feels like too much for you today, I'd like you to hold an isometric hold, keeping the pelvis up as we march. We're going to extend one shin, pressing heavy into the bone of the opposite toe, the toe that's staying down, keeping the hips even and elevated, holding for a full inhale and exhale, and then lowering on your next inhale to switch sides. We don't want the hips shifting side to side or dropping, one staying higher than the other. They should stay at the same height as we extend the shin. We're working to balance out and strengthen the glute max and glute min. Make sure your pelvis is up. You're breathing in through your nose, bracing those abs before you extend the leg. You inhale, prepare, you brace the abs again. You inhale, and you control the descent of that shin as it comes down. Let's do one more. Using the breath, lifting up on those muscles that stop your stream of pee, holding that lift as you fog a mirror with your exhale. Inhale again, brace the abs, fog a mirror as you lower that shin down and bring the upper body, mid-back to tailbone down, sliding the roller to the side, coming up to sit. Great work.